Fellowship of the Great Physician welcomes you to House Call. Our hosts today are doctors of chiropractic, Dr. Gerald Mala and Dr. Richard Jensen, who is also a board-certified acupuncturist, practice independently in North Oaks, Minnesota. Let's join our hosts for today's program that will assist you in your quest for optimum health and well-being.
Welcome to House Call. I'm Dr. Gerald Lala.
And I'm Dr. Richard Jensen.
Wonderful to have you with us today again on House Call. It's nice of you to invite us to make a house call with you, and hopefully the Holy Spirit will be with us too, because we believe Jesus is a great physician, and that when a person accepts Christ into their heart, the Holy Spirit comes within them, begins to empower them, and if you'll be baptized in the Holy Spirit, He'll come alive, and He'll lead and guide you just like He did Jesus, and He'll be your personal physician. So, we are continuing the series. This, I think, is part 9 of You and Your Hormones, and today we're going to talk about anti-estrogenic compounds. We're going to talk about natural anti-estrogenic compounds, because we know if we have too excessive levels of estrogen in our blood, it's going to cause a lot of health problems. So some of them are reported to include germanium, asparagus, iodine, and citrus pectin. Now, germanium is reported to increase the supply of oxygen to tissues, therefore influencing better health to our tissues. If you don't have oxygen, boy, you get sick, don't you? Now, asparagus, wow, assists in the flushing of the kidneys and turning the body more alkaline, which is important, as very often the body is quite acid when there is estrogen dominance or when cancer exists. Iodine assists in balancing the basal metabolic rate, that's the BMR of the body. And citrus pectin is reported to inhibit metastasis and chelate heavy metals. What does that mean? It inhibits the growth of the proliferation of abnormal cells such as cancer cells, and to chelate or assist the body in pulling out toxic metals. And so we know that toxic metals cause a lot of problems, and we know that they're very, very high often in people with Alzheimer's, dementia, Parkinson's, and so that's important. Now, how about herbs? Okay, some of the herbs that are known and reported to be or have anti-estrogenic properties, including red raspberry, licorice, that's not the candy licorice, that's not an herb in there, ginseng, ding, 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 squaw, sarsaparilla, and lavender. Now, let's talk about low testosterone, a male libido problem. What are the common characteristics of men who have that issue? They have a decreased sexual interest. They have, therefore, a drop in their androgens, or the male hormones. There generally is poor concentration and malaise. Many times that's due to hypergonadism, and it's always interesting when you get around these guys who are taking anabolic steroids. If you look at their testes, they're about as big as peas after they've been on them for a while. So now let's talk about prostatic hypertrophy and cancer. And when you walk through the locker room with some of those guys, I'll tell you the urinals really smell different when they're on anabolic steroids. So prostatic hypertrophy and cancer, PSA, or the prostate stimulating antigen, results of inappropriate metabolism of testosterone. So the PSA level goes up when the body is not metabolizing testosterone correctly.
And in seeking out excellence, this is one of the things that got past me. It's not prostate stimulating antigen or stimulating antigen, it's prostate specific antigen.
Specific. Thank you very much.
You're welcome.
Testosterone is not the problem, and then we're going to talk, Dr. Jensen has previously talked about aromatase, which is an enzyme that converts estrogens. So isoflavones and prostatic hypertrophy. The PSA, a metabolite associated with increased benign prostatic hypertrophy or enlargement. Okay, prostatic cancer is fueled by, guess what, excess estrogens, as is breast and uterine cancer. Now, what could we do to promote? What does science know today? Not some nutrition company, okay, but science, legitimate, credible science. What does it know that can encourage a healthier prostate? Well, here are the following things. The mineral magnesium, zinc, iodine, germanium, glutamic acid, glycine, asparagus, alanine, citrus pectin, saw palmetto extract, prostatic concentrate. That's where they take and they make a concentrate out of it. Pliglim bark, pumpkin seed, Uva eucera leaf concentrate, unsaturated fatty acids, pollen extract, and soy foods. Now, soy foods containing phytochemicals, ginseng, and dioxin lower the risk of benign prostatic hypertrophy and aid in the treatment of cancer, atherosclerosis, estrogen imbalances, high cholesterol, and elevated high-density lipoproteins. Now, is that a guarantee or something? No, that's out in the literature. Should you try it? I don't know. Ask your nutritionally oriented nutritionist or chiropractor who practice, if they practice science-based nutrition and they do a diagnostic test. I mean, why would I go and take something at my age, or any male, adult male, take these things if he doesn't know what his PSA is to begin with, okay? Or continue, if he's got an elevated PSA and starts taking them, wouldn't it make sense to measure that over a period of time? Now, we're going to talk about what's called IgG and IG4 food sensitivities with reference to prostate problems and estrogen problems in females. So Dr. Jensen, I think, is going to discuss that, right?
Thank you, Dr. Lala. Well, one of the things that we look at is if there's deleterious effects on our body, such as things as inflammation. Inflammation can help increase some of these problems because it's because of the immune system functioning at a higher rate can increase inflammation in those areas, and inflammation increases free radicals, and free radicals then can go in and they work with electron dense tissues, which would include your DNA, and when you mess with your DNA, you increase the chances of having cancers. So, having gone through that whole big round, let's look at determining your individual biosensitivities. There are two different types of sensitivities, and we look at different immunoglobulins. And globulin is a type of protein within the blood. It's related to your immune system in this case, and it checks whether you can have fixed or cyclic food allergies. And many times the fixed food allergies you find, they're the ones that you probably know somewhat which ones these are. They're the ones that you normally have a bit of an immediate reaction to. But the cyclic ones build up in your system and can take about 4 days to even a week to clear from your system. And one of the reasons why we look at this is, let's say you're taking some kind of herb or food or something that you're taking to help with, say in this case, estrogen or estrogen sensitive type things. Let's say asparagus is one of those common foods that was mentioned earlier in the show. Asparagus, great, you know, so a lot of you go out there and start buying and eating more asparagus. But what if you're sensitive to asparagus? And after eating it, you're just like, wow, I know I'm doing something good for my body, and you're fixated on that, but you just start to have more of a sense of malaise about you. Well, that's because maybe you are allergic to asparagus and you're adding more of what we call, where it's been said by, I believe it's Hippocrates, said, one man's food is another man's poison. And what you're doing is taking what's information is saying that's a good thing for you for this kind of condition, and you're feeding yourself the wrong thing because it's a poison to you. And I've seen that before in people who are taking, say, garlic and say that garlic's really good for you, and it does. It has really good effects and it helps you on many different areas. But this person's taking a huge supplement of garlic. They're taking an allergen at a highly concentrated rate for themselves, and was adding to more of a malaise, and not knowing why, because they're taking only good things for themselves. It's not until you had the testing that said it was bad for you that then stopped that progression. Transdermal hormone creams. In 1938, Dr. Russell E. Marker discovered a naturally occurring chemical saponin in Mexican wild yam gourds, which he found that he could transform into a fat-like progesterone, which then could be combined with other complementary natural ingredients and used as a highly absorbable transdermal skin moisturizing progesterone-containing cream that could be applied to estrogen and progesterone receptor sensitive areas of the body, such as on the breasts or what have you. And in 1978, Dr. Roy Peat discovered a method of synthesizing the natural progesterone from wild yam gourds as well. So what we're finding is transdermal hormone creams, they're naturally occurring hormones that are fat soluble and can pass right through the skin and therefore be administered more closely to those areas in which you're trying to oppose overabundant estrogen in those tissues. How about plant sterols, Dr. Lala?
Well, what that means is that there are certain plants that contain phytoestrogenic compounds that can produce sterols, and they're members of what's called the Dioscorea family. And we're listing them on the screen there for you now. And what they do is they support DHEA synthesis, or the manufacture of DHEA in your body. Now, we were talking a great deal about hormones here, and we should talk a little bit about hormone balancing. How do you determine what your hormones are? Do you go to a chiropractor? Maybe it's a woman chiropractor, and you think, well, if I go to a woman medical doctor, a chiropractor, woman nutritionist, she'll understand more about me. Well, she might underdo that. That might be the case, but what is her scientific basis of suggesting that you use a transdermal cream, or that you go on a phytoestrogenic diet, or you go on an anti-estrogenic diet? There must be some science basis to make those recommendations. Now, when it's not, then they're just saying, well, try this cream, try this pill, try this vitamin, try this herb. That's playing Russian roulette. It's like a shotgun. It's just aiming at it, because I don't know what's inside of your body. Now, some people will say, well, we can do a kinesiological muscle test to tell me that you're weak in this and high in that and that. Well, there's some scientific validity to that. We're not against that at all. We practice kinesiology in our own clinic, but the fact is that we want to compare what the kinesiological muscle weakness or excess strength is showing us with, for example, with no less than a 24-hour female hormone analysis. If it's in the case of the male, then we do a 24-hour male hormone analysis. Same thing goes with birth control pills. They prescribe a lot of birth control pills to balance out hormones. Well, they're prescribing those pills generally without any hormone testing. Again, it's Russian roulette. And you say, well, the doctor told me this, the chiropractor told me this, nutrition told me to do this, and they got all these education and all these degrees and all these diplomas on the wall. Well, it doesn't necessarily mean that I know what's going on inside of your body. Certainly kinesiology gives me some of an idea, but nothing like a 24-hour hormone analysis. The same thing happens there. The same subject, the same realm enters with using natural progesterone therapy. Maybe I need it. Maybe I have symptoms that would indicate it, but let's check out the hormones before we get into that. So then let's look at some natural solutions that we know to have proven reasonably effective. Chiropractic care. Why? Because the brain is like an electrical generator. The spinal cord is the main power cord coming out from the electrical generating plant. The nerves pass out their little holes in the spine called intervertebral foramina. And guess what? The vertebrae then act like a switchboard to the nervous system. So even though we have these hormones and enzymes and neurotransmitters and all of these things floating around in our blood, still those organs are not going to function correctly if there is a reduction of proper nerve and blood supply to those organs. So again, to have nutritional therapy for hormone issues, great, as long as it's science-based. But to not have the spine in its best possible alignment on a regular basis, there's an issue there. Now, how about metabolic therapy? That's what we're really talking about here, that we would do blood and urine tests appropriate to your age, to your gender, to your symptoms, or to your goals for health, to establish what is your metabolic status, the internal systemic basis of your body. And there are science-based tests that can be ordered that will do that. Now, Tribostan is another chemical that sometimes some authorities say is good to balance out hormones. I don't know about that or not. That's a claim. And another good thing to do is to avoid tobacco smoke and alcohol, as they do not encourage good health in any dimension. So tribostan is a botanical taken from plants. Tiberius terrarius has been reported to increase the body's natural production of testosterone. So we're going to look at a little slide that's going to show us the spine and nervous system here. Again, what we're going to see is the brain, then the spine, and housed inside of the spine is the spinal cord. It's the main power line going out to all those organs you see out on the screen. So we can see there's your heart up there, and then down to your lungs, and then your stomach, and oh, there's your liver now. Wow, here comes down your liver, and here's your intestines, yep, and all the way down, and then there's the reproductive organs. So if there is interruption or a lack of proper nerve or blood supply in and out of those organs, doesn't matter how good you eat, they're not going to function as good as they should. And certainly I found that over the years, that if we look at the next slide and try to keep that spine in perfect or as near perfect alignment as possible, in other words, subluxation free as possible. So what we see there now, we see this is a side view of an illustration of a spine. There's a disc up there at A. There it is, yep, and that's a nice normal disc, and back of it, of that disc where a B arrow goes to, that's that intervertebral foramina where the nerves pass out of the spinal cord. In addition to nerves, pass out arteries, nerves, veins, lymphatics, and acupuncture meridians, and there they're indicating how that healthy nerve should look. Now if we look, that's C. Now if we go down to D, we see that vertebra has lost its normal juxtaposition from the one above and the one below, and that's called a subluxation, which is a minor dislocation. And of course, that's a fundamental basis of chiropractic. But as good as it is to get that spine in as near normal alignment as possible, if you don't eat right, then it's going to adversely affect your spine, just as if you're going to eat right and not have a spinal in alignment and good chiropractic care on a regular basis, you're not going to be as healthy as possible. Now let's talk about the subject of pharmaceutical versus food-grade food supplements. There are two varieties, and we've done other programs that we would invite you to go out on our website and look up with reference, are your vitamins poisoning you? That would be the subject you'd go out and look at, because there are all kinds of different manufacturers of foods, but there's primarily two categories. One is called pharmaceutical grade, the other is food grade. When it comes to transdermal creams, such as progesterone, there are many transdermal progesterone creams available. You can't go in the health food store or most chiropractors and nutritionists' office who have pharmacies in their places that aren't selling them. But most are not pharmaceutical grade because the amount of percentage of natural progesterone is so low or of such poor quality, in other words, not taken from Mexican wild yam gourd, that it is little to no value. So now you say, well, it says there's 80% in here. Well, what we want to know from those distributors is we want to know what the independent laboratory analysis says of those products. And would you believe it that the mass majority of them will never, when we ask them for it, they will never give us an independent laboratory analysis, because number one, they either haven't had one performed, or number two, they do, and the level of the chemicals that should be in it just aren't there. So you've got a lot of women out here using natural progesterone creams, and it's of no value to them other than it maybe have some glycine and some oils in here to keep the breast tissue soft. Now, why would they commonly say, well, rub it on the breast area here or down in the abdomen? Because those are highly receptors located there, estrogen and progesterone receptors there, and it's areas that are more softer on most people, as opposed to on my hand here that's got a lot of callus on it, so that's generally not in the abdomen or the breast. So it becomes a thing that you'd want to deal with pharmaceutical grade, and to my knowledge, you are never going to find a pharmaceutical grade in a health food store, because they are only supposed to be in healthcare practitioners' offices. So now, what does that bring us to? It brings us to a term of which we call voodoo nutrition or snake oil people. So what does that mean? It means that even though I'm a licensed doctor of chiropractic, And even though we have a preventative health care practice rather than an acute care practice where people are just coming in to get their bones cracked whenever they feel like it, and there's a place for that in chiropractic. I'm glad there are chiropractors like that, but we know that as valuable as that is, that we are more involved in sustaining and improving the quality of life of the people that come to us. So those who just want to cricken their neck, crack in the back and out, they belong in another chiropractic office, and we're glad that they go there. They're getting a good service, we assume. But the thing is that there are a lot of people out there who are making all kinds of claims about this vitamin will do that, and that herb will do that, and this cream will do that, and this essential oil will do that. And in fact, there is no credible scientific basis to prove that. Yes, they may have testimonies. Yes, they may have some anecdotal information. But when we go out and search out those organizations, we don't find the credibility out there. So it doesn't surprise me why a lot of legitimate chiropractors who are nutritionally oriented and medical doctors scoff at a lot of these people that are selling these vitamins and these homeopathic remedies, these essential oils, because we know from our own education as well as, we work with this day in and day out. We work with it day in and day out. So it's not like something that's remote to us. Like for me, stomach surgery is pretty remote from my practice. Okay, I know about it, I know what they do, but it's very remote. So I don't bother trying to learn anything about it because I'm never going to have anything to do with it other than we're going to get patients who are nutritionally oriented before or either after the surgery. But the fact is that there is so much out in this nutrition and so-called alternative health care and this so-called wellness care. All these people, these institutions saying wellness care. Well, it's just a term. It's like saying we get better gas mileage or our car rides better. It's just a hyped up term. When in fact you go in there and you find out how little wellness care there is there. You find out how little alternative care there is, or you find out that the place is basically set up to be a pharmacy to just do nothing but sell a lot of vitamins and minerals without proven scientific testing. Now let's talk about the natural and synthetic. So natural, they say, causes no adverse effects. Well, natural can cause adverse effects. We've talked about that in the other programs that we've been doing on you and your hormones. But we know for sure that synthetics do cause adverse effects. Now, there's a thing called accumulative effects. I can take vitamin A at for a week or 2 weeks, and I can take it, and it probably won't have any adverse effects on me. But it is going to have some accumulative adverse effects if I'm taking the incorrect amounts. In other words, if I haven't done a blood test to determine how much vitamin A my body needs or doesn't need, that's going to have an accumulative adverse effect. Just as much as every drug is going to have an accumulative adverse effect that may not show up today or tomorrow. It may not show up this year, but eventually it's going to, because it is causing microbiochemical trauma inside of that body. And it's building up. Just like if you're saying, well, take an aspirin to keep your blood thin. Well, why don't you take something that doesn't cause bleeding like aspirin does in the gastrointestinal sac, and you take something like an essential oil that doesn't cause adverse effects and is proven to be scientifically helpful to keeping the blood at its normal homeostasis and normal thinness instead of something like Coumadin. I'm not telling you to go off of Coumadin in any way. I'm not saying your medical doctor's wrong. It's just that, look, Lutherans think a certain way, Catholics think a certain way. We non-denominational people are right in the middle. We take the best of everything of the denominations and say, where is Jesus in this? Is Jesus in this or not? So is science in this or not? For we are destroyed for a lack of knowledge. We really are. And so again, if we're not out there searching and learning and gaining in not only scientific knowledge, but spiritual wisdom, godly wisdom, Jesus' wisdom, then we're going to end up as fools. But say if we're taking that aspirin, we don't see any blood in our urine or our feces if we bother looking or checking for it. But over a period of time, that's going to continue to aggravate the lining of the stomach. It's going to continue to throw off the acid-alkaline-base balance of the gastrointestinal tract. It's going to continue to interfere with proper digestion of fats, carbohydrates, and proteins. It's going to continue to interfere with the body absorbing the vitamins and minerals and herbs and homeopathics and essential oils that you may be taking in your diet. But again, if I continue to do something, I can rub this hand and it's not going to bother that skin. But if I keep rubbing, I'm not using much pressure at all. But if I continue to have that slight irritation, pretty soon it's going to cause a problem. So there's accumulative effects. And that means then, like drugs, they all have a varying half-life. It means that a certain amount is used by the body, but a certain amount is stored up where? In the fat cells, see? Yeah. In the fat cells. So that's why we talk about, well, when you eat animal fats, you're going to be absorbing the hormones that animal ingested.
And what contains a lot of fat, where is a huge concentration of fat? Up in the brain.
Right. Think about that. Now talk about that, the brain and Alzheimer's and Parkinson's and these dementia issues.
Certainly, as we look at the brain is covered by fat. And it helps cushion it for one, but also what we find is fat actually has a way of making the signals skip around, actually speeding up how fast those messages get from one place to another. And that's part of why with children, when they're first born, they can't walk like some other animals. You see a deer born, they stand up within minutes and walking around, whereas for humans, they're infants, they go out, it takes a year for their nervous system to fully develop to the point where not just that the nerves are there, it's just that because the fat layer isn't on there all the way, the nerves aren't fast enough to coordinate for the walking. So that's where part of the development of the nervous system has to continue. In fact, babies have a lot more nervous tissue than we do as adults, for the point that they say now in child research that you look at your kids and you say, my God, they're geniuses. Well, they're saying now with brain research that they literally are geniuses, and that what happens is as we grow up, we become a little more efficient, and so some of those brain tracts are destroyed within that, just so that we can function better where we're at. So again, if you're storing all these estrogens and all these other types of chemicals in our brain, or should we say toxic metals and things, it's going to start to disturb some of those things. And within that, such as they talk about an accumulation of aluminum in the fat cells of the brain, that starts causing some deleterious effects for Alzheimer's. And so we can start to have some dementia in that regard. And many times there's a lot of neurological problems that we find in such diseases as multiple sclerosis that are mitigated by having toxic metals deposited within the brain.
Heavy metal is a heavy metal.
That's right.
And it's heavy on the body. It's deleterious to the body, just as drugs are. So maybe you're in a situation where you have to take a drug to sustain your health. And that's good if that drug is working for you. But look at the natural as well. As Thomas Edison said, the doctor of the future will give no drugs, but interest his patient in the care of the human frame and diet. And so all drugs have adverse effects. The way they advertise them on TV doesn't sound like that. And actually the medical doctor, it's not really his or her fault. What other tool does the medical doctor have other than to do nothing or to prescribe a drug? That's what they're trained in. The chiropractor is trained to adjust vertebra. That's good, but there's much more to the whole person, just as we are a spirit living in a body with a soul, a mind, and memory. Therefore, God is a spirit. If God is a spirit, then He created us as a spirit who resides in a body. This is just a temporary vehicle that we have here on earth. And so when you look to Jesus as the great physician and invite Him into your life and invite the power of His Holy Spirit to come alive, then you're going to have the wisdom and the knowledge and the miracle powers of the Holy Spirit working inside of you. And we have that on Thursday nights when we get together as Jesus people. We do.
House Call TV has been brought to you by the Fellowship of the Great Physician. For further information, please call at 651-484-8521 or visit our website at www.housecalltv.org. Until next time, thank you for listening to House Call.